Good morning, Dr. Mercer, and thanks so much for taking the time to speak with us today.
Well, thank you. It's my pleasure.
So I thought, first of all, we could just start with a bit of an overview of what the current status is of Guelph and Wellington.
Yeah, well, the status is continuing to change, but if you look at our website, we continue to notice that there is an increase in cases. However, the number of cases, the increase has definitely slowed over recent weeks. We always like to talk about in our area, there's really two pandemics that are occurring. There's the pandemic that's out in the community, which is definitely slowing, and we're seeing far less cases. And then there's the pandemic that's occurring within the healthcare sector, particularly our long-term care and our retirement homes. And those are the ones that continue to see an increase in cases.
Are we sort of where we thought we might be? Have we been successful in sort of flattening the curve?
That's a really good question. I think where we had hoped to be would always have been to have no more cases. I think realistically, though, when we look at other countries, we see that you have an increase in cases. There's a period of time where the cases kind of flatten out, and then it does take quite a while. It takes actually almost as long to get out of it as it does to get into it. And then there's always that worry and wonder about, will you have the odd case here and there continuing until we find a vaccine, or unless there is a treatment for this particular virus.
Now, have the early concerns of not having enough PPE been addressed? Are the needs met?
No, actually, there's still a continuing need for PPE. I know that we're continuing to source, particularly the provincial government, our federal government, and even locally trying to get resources. And I'm sure that manufacturers are working full tilt to try and produce this, but the needs are still there. The conservation efforts that we are using as a sector really are helping, though. And so that was a number of weeks ago now that we put into place some significant conservation of PPE, in particular our masks that we use. And some places have moved to washable gowns as opposed to disposable gowns. Those efforts are really playing a part. And I also understand that we will be able to very soon be able to re-sterilize our N95 masks so that they can be reused. So hospitals in particular and all healthcare organizations have been saving their N95 masks, and very recently it was announced that there will be a process that's going to be announced very soon that those can be reused. And I think that's very good.
That's wonderful news.
That's great
now,
news,
for
yeah.
years, we've put programs and services in place to enable seniors and persons with varying levels of abilities to stay in their own homes. How are we keeping both those who deliver those services and those who receive them safe?
Yeah, well, some of those services actually have changed. So home and community care, which does provide a lot of services to seniors, the medical care. Some of those who are in the lesser need categories, those that had lower levels of need, did have their services discontinued for a period of time, whereas those who had moderate or significant needs had their services retained. So people who really need the service are still getting the service, and those who could manage for a while are asked to wait for a while for those services. So we could redeploy those staff back into the long-term care sector, because there's a huge need right now for staffing in the long-term care and retirement home sector. So yes, it is. I know some services are continuing, and still call your doctor. And your doctor will pay you a virtual visit. And occasionally, if you really need to see your physician, you can safely go into the office for urgent conditions.
Now, certainly it's so lovely today to see the sunshine with nicer, warmer weather and people having been in lockdown for at least a month or more. The temptation to go out and take greater risks is greater. But does that increase then the risk of the virus resurging?
Yeah, very good question. So first of all, I'm well aware that there have been people who've been cheating on their isolation. We know that some of our golf courses have found that people are walking on and are playing without notifying or paying the golf course because they're closed. I do know that it's a huge temptation. There are lots of things you can do outside though right now that are safe. So certainly work in your own backyard, garden. Think about what that might look like. You can actually order online from the garden centers locally. You can order and have those products delivered right to your doorstep. So there's no need to think that you can't do your own backyard and your own garden. You can take the dog for a walk. It's about how you enjoy the warmer weather. Do I think there will be a resurgence? If you look at the modeling, we do know that unless we get a vaccine or a treatment, and most of our population are not immune to this virus, that there is a very good chance it could come back unless we all practice physical distancing and change our behaviors for some time to come, actually.
And I think that's the thing. It's really difficult for anyone at this point to predict what it's going to do, because a lot of that is dependent upon us and our reaction.
Well, it is. And sometimes people see this as a disease of seniors. And I really want to dispel that myth. We do find that there are lots of people who are younger than seniors, people who would not see themselves as older. So anybody, say, between the ages of 50 and 65. We still see that there are those individuals who are hospitalized, and some of them are on ventilators right now. So this disease can affect people right from children, youth, young adults, right through to seniors. Now, the outcomes do tend to be much worse for those who are older, but we still do see deaths, sadly, in those who are in what most people would not describe as old age, those in their 50s.
Now, watching all the media coverage can be both a good and a bad thing. It's a fine line between being informed and being overwhelmed. So what message would you like to leave our viewers with today?
Yeah, I think it's important to stay up to date, but not to feel overwhelmed. It is not necessary to watch every single news channel and to count the cases every day. I would advise your viewers to choose a reputable source of information, a website that you can trust. You could go to our website, Wellington-Dufferin-Guelph Public Health.ca, and you will find a link there, and we will guide you to good sources of information. Don't dwell on it. Be aware, stay informed, stay safe, but remember that most of what is happening is outside of all of our control, other than the things that we can do. Wash your hands, stay home and only take important or urgent visits, and practice physical distancing when you must go out.
Well, thank you, Dr. Mercer, and thank you to everyone that you're working with, and all the frontline workers and all the city workers and everyone that's working so hard to keep us safe. We really appreciate what you're doing.
Well, thank you very much. And thank you to all of your viewers, because when you guys stay home, you keep us safe. So thank you.